Minister Miller, thanks for joining us. What are some of the specific things Indigenous communities can use the $305 million fund for?
Well, first, thanks, Dennis, for having me on. And I'm here from Skype practicing social distancing, as we all should be doing during this period. I'd love to be in studio, but unfortunately, we all have to be responsible and stay away from each other, frankly, during this period that's going to last a long time. Look, obviously what we've heard from communities is to have, and nations, to have the maximum amount of flexibility in the way they use their funds to flatten that curve, which is a very, very serious global pandemic. And so what I've instructed my team to do at Indigenous Services Canada, and what we are looking at, is a rapid deployment of funds into communities as quickly as possible, so that there is maximum amount of flexibility in using those funds to prepare, plan, get the very important public health message out to stay at home, self-isolate, look for symptoms, and to practice that basic hygiene that is so key every year during the flu season, but is even more important now. And so, conscious that there is and will be a vote on this, my team is working hard on working at those allocations for communities to know, so that they know that they have the backing of the Government of Canada in the amounts that will allow them to plan and purchase material to plan for this.
So we've known about the virus for weeks. Why so long to respond, and how will the funds be allocated?
Well, so Dennis, the most important thing that has been going on over the last few weeks is to have teams in contact with local health leadership, whether that's elected council or other, to ensure that the very, very basic message to practice self-isolation, social distancing, good, proper hygiene, in tandem with the very important pandemic plans that are in place in communities, are respected. This is proven science to flatten that curve that will limit the impact on the health system. As we've been clear, this isn't a question of if, it is a question of when. In tandem with that, obviously, is the important discussion, particularly Indigenous communities, about availability of resources with respect to a healthcare system that they've been underserved by historically. And so that is a message that we've heard loud and clear. The announcement by the Prime Minister was 2 days ago. And so our action at the Government of Canada has been solely focused on ensuring that those funds are deployed so that there's a maximum amount of flexibility on a distinctions-based scenario in communities, and that includes Inuit, Métis, First Nations, self-governing, and modern treaty.
Right, but so how will the funds be allocated? Is it going to be based on needs, urgency?
Well, let me be clear about this. This is the beginning of a conversation in terms of financial, in terms of physical resources. We know from our lessons from H1N1 that Indigenous communities are not only disproportionately affected, but it can vary from region to region. So as you trace the course of this pandemic, you have to plan for a number of things. One, the immediate need and sanitary hygienic resources that communities need, and need the financial backing of the Government of Canada to ensure that they are not out of pocket. And that's what we are moving to do. There is also amounts that are set aside to plan for surge capacity, whether that's personal protective equipment, testing kits, movable units that can be deployed in a very rapid fashion to address any surge that we may see. Luckily, that has not occurred yet. It doesn't mean that we're not planning for it. So you have to look at this in a number of elements, and this is not something that is going to go away in 2 weeks. People need to be very, very conscious of the fact that this could last a very, very long time, and part of the epidemiological planning of this is to flatten the so-called curve so there's no impact on the health system. But that also means a longer onset of the pandemic, but then the healthcare system can move in and help, and frankly, keep people healthy and stay alive.
So yesterday you said if Indigenous leaders have any concerns to contact your team directly. What do you do if a call comes in and an isolated community is feeling fearful and overwhelmed?
Well, again, the remote communities face a number of risks on a daily basis, and faced in a pandemic, that just creates not only exponential fear, but exponential risk. And so our teams, whether that's regional offices, whether that is planning and support from various levels of the government that are engaged in this, stand ready to help. We faced unique challenges with fly-in communities. There are 96 First Nation communities that are fly-in in nature. There are 51 Inuit communities that face a similar situation. So they may have accrued needs that we will respond quite quickly on when we hear it. There are various decisions being made across the country as to self-isolation, which comports risk. But as we are doing and as we have done over the last month or so, we've been engaged with health leadership, whether that's nurses or doctors or health authorities in the communities, to make sure the protocols are being observed. And I would encourage anyone listening to this to observe those protocols, because they are demonstrated by science to reduce that curve, but also ensure that the resources are in place and the capacity is in place in the event of a surge need and the surge capacity that is required in the community.
As you know, we're about to come up on a time that's the annual spring flooding. What help will communities have to evacuate if that's the case?
Well, in the face of the pandemic, there are a bunch of unique challenges, and the risk obviously is accrued. There are some communities that face geographical challenges. They may sit on wetlands, and a number of them have declared states of emergencies. That will require resources that are over and above those we would use for pandemic planning. And obviously, we have to be sensitive to the fact that in situations of overcrowding, the risk of propagation is greater. So we're very, very sensitive to this. I've received letters from chiefs and tribal councils to that effect, and our department stands ready to deploy the resources that are needed based on additional risks, among which are flooding challenges.
Well, Minister, a lot of questions still out there. We do appreciate you taking some time for us here today, though.
Well, thank you for having me on.